Welcome to Ulosca channel. Access all nursing practice questions. ATI Nursing Final Assessment Fall Practice Questions with Answers.
Question 1. A nurse is caring for a client who is on fall precautions. Which of the following actions should the nurse take? A. Keep the side rails lowered at all times. B. Place the bed in the highest position. C. Ensure the call light is within reach. D. Encourage the client to ambulate unassisted. Which one is the correct answer? The correct answer is C. Ensure the call light is within reach. Explanation. Ensuring the call light is within the client's reach allows them to easily call for assistance rather than attempting to move unassisted, which increases the risk of falls. Fall prevention involves removing hazards, adjusting the environment for safety, and promoting supervised mobility. Question 2. A nurse is performing medication reconciliation for a newly admitted client. Which of the following should the nurse do first? A. Compare current medications to new prescriptions. B. Document medication changes in the chart. C. Report discrepancies to the pharmacist. D. Ask the client about home medications. Which one is the correct answer? The correct answer is D. Ask the client about home medications. Explanation. The first step in medication reconciliation is to collect a complete list of all medications the client currently takes, including prescriptions, over-the-counter drugs, and supplements. This ensures accurate updates and prevents medication errors upon admission. Question 3. A nurse is preparing to insert an indwelling urinary catheter. Which of the following statements indicates the correct technique? A. I will clean the meatus from back to front. B. I will inflate the balloon before insertion. C. I will use sterile gloves during the procedure. D. I will position the client supine with knees extended. Which one is the correct answer? The correct answer is C. I will use sterile gloves during the procedure. Explanation. Inserting a catheter is a sterile procedure to prevent urinary tract infections. Using sterile gloves protects the urinary tract from bacteria and maintains a safe environment for the client. Non-sterile technique significantly increases infection risk. Question 4. A client is on a low-residue diet. Which of the following foods should the nurse recommend? A. Fresh corn. B. Raw carrots. C. White rice. D. Whole wheat bread. Which one is the correct answer? The correct answer is C. White rice. Explanation. A low-residue diet limits high-fiber foods to reduce the amount of undigested material passing through the bowel. White rice is easily digestible and gentle on the digestive tract, making it suitable for clients with gastrointestinal issues. Question 5. A nurse is delegating a task to an assistive personnel. Which of the following tasks is appropriate to delegate? A. Assessing pain level. B. Administering oral medication. C. Ambulating a stable client. D. Teaching deep breathing exercises. Which one is the correct answer? The correct answer is C. Ambulating a stable client. Explanation. Delegation to an AP must be within their scope of practice. Ambulating a stable client is a routine task that can be safely performed by an AP, whereas assessment, medication administration, and teaching require clinical judgment and should be done by a licensed nurse. Question 6. A nurse is caring for a client who has a stage 3 pressure injury. Which of the following interventions should the nurse implement? A. Apply a transparent dressing. B. Use a hydrocolloid dressing. C. Apply an antiseptic powder. D. Leave the wound open to air. Which one is the correct answer? The correct answer is B. Use a hydrocolloid dressing. Explanation. A hydrocolloid dressing maintains a moist wound environment and supports healing by promoting autolytic debridement. It's appropriate for stage 2 and 3 pressure injuries and helps protect the wound from external contaminants. Question 7. A nurse is caring for a client with a new colostomy. Which of the following findings should the nurse report to the provider? A. Pink, moist stoma. B. Mild swelling around stoma. C. Dark purple stoma. D. Small amount of mucus in the pouch. Which one is the correct answer? The correct answer is C. Dark purple stoma. Explanation. A stoma should appear pink or red and moist. A dark purple or blue color suggests poor blood supply or tissue necrosis, which is a medical emergency and must be reported immediately to prevent complications. Question 8. A nurse is reinforcing teaching about home oxygen use. Which of the following client statements indicates understanding? A. I will keep the oxygen tank near the heater. B. I will use wool blankets in bed. C. I will check the oxygen level every few hours. D. I will avoid using petroleum jelly near my nose. Which one is the correct answer? The correct answer is D. I will avoid using petroleum jelly near my nose. Explanation. Petroleum-based products are flammable and pose a fire hazard when used with oxygen. Clients should use water-based lubricants and keep oxygen sources away from heat, flames, or electrical sparks to prevent accidents. Question 9. A nurse is caring for a client who is postoperative. Which of the following actions helps prevent respiratory complications? A. Withhold fluids for 12 hours. B. Encourage early ambulation. C. Maintain supine position. D. Restrict coughing and deep breathing. Which one is the correct answer? The correct answer is B. Encourage early ambulation. Explanation. Early ambulation promotes lung expansion, mobilizes secretions, improves circulation, and reduces the risk of pneumonia and atelectasis. It is a key component of postoperative respiratory care. Question 10. A nurse is preparing to administer a medication via a nasogastric tube. Which of the following should the nurse do first? A. Mix the medication with enteral feeding. B. Flush the tube with 30 milliliters of water. C. Check tube placement. D. Crush all medications together. Which one is the correct answer? The correct answer is C. Check tube placement. Explanation. Checking NG tube placement is essential to verify the tube is in the stomach and not in the lungs. This ensures that medications are safely administered into the gastrointestinal tract, preventing aspiration or complications.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.